He should have been wearing a mask all along, and sort of he didn't take it seriously. And I wasn't shocked, but I'm sure a lot of people thought, well, it serves him right. Look, I don't wish any bad on anybody, but he should have been a little bit more diligent about this, and he didn't take it seriously, and unfortunately it got political.
As far as you know, what has his treatment been?
So he's gotten treatment that you and I would not be able to get, okay? So my feeling on this is that he wasn't hospitalized because he was sick. He was hospitalized so he can get the therapy. Now, all these drugs, and I've heard other doctors talk on the television and on the radio that he was very ill because he got dexamethasone and he got remdesivir. But what they did not mention is this remdesivir drug can be used on compassionate use for hospitalized patients. The FDA has something out where you can use it on anybody. You don't have to be that ill. He couldn't have gotten it at home, so he was hospitalized to get all these concoctions that you and I probably wouldn't get. Mm-hmm. He got this monoclonal antibody concoction that is experimental, and Trump got a higher dose than normal because their drug really can't hurt, but you and I would not have access. So he got dexamethasone, which is steroids. Anybody can get that for anything. It's an anti-inflammatory. The remdesivir, we couldn't have gotten, nobody could have gotten, but he got it because he's the president, and he had to do it in the hospital. And the monoclonal antibody by Gilead is another one that he got on experimental basis. It's not approved. Nobody could have gotten it. So I think that he was hospitalized just to get access to these medicines because you can't give this in the house. So I'm not so sure he was so sick. I don't know this. This is just my thought. He needed to be in the hospital to get this concoction that what he had gotten. Now, he's taken zinc and vitamin D, and there's a drug called famotidine, and melatonin and aspirin. He's taking those probably on a regular basis, probably was taking that just to prevent. You notice he did not get hydroxychloroquine, at least not that we know of.
Mm-hmm. Does it worry you, concern you that the President of the United States is taking, as you put it, a concoction that is experimental?
Well, look, at this monoclonal antibody seems to be pretty safe, what I understand about it. No, it really doesn't. I mean, you would want that, too. You would want everything if you had COVID to prevent a severe respiratory illness. So I don't think it worries me as much as the fact that it concerns me that he gets it and nobody else can.
You said that he should have been more careful. He should have been more cautious. What do you think the president should have said when you've got Dr. Fauci going on 60 Minutes on March 8th, as late as March 8th, arguing that there's no reason to be walking around with a mask?
Yeah, no, I'm not going to get political again, Larry, like I told you, but look, as a doctor, sometimes we learn more as time goes on, mm-hmm. and I mentioned this before, and back then we did not have all the numbers. I don't think they really understood the COVID-19 like they do now. So, like I said, I'm not going to blame Dr. Fauci. I think Fauci's an upstanding guy. But I will tell you that I have recommended different treatment a month after a diagnosis of somebody because I got more information. So I cannot blame him for that. But look, mask in my mind should have been mandated. Mm-hmm. I mean, what's the harm of wearing a mask?
The president is 74 years old. He is a male. Those are high-risk factors to consider, correct?
Yes, it seems like elderly elderly, my God, we're all getting there, so 74 doesn't seem that old to me. But yes, there's a higher risk in somebody who's a little bit older with comorbid conditions. I don't know what his medical history is. Males tend to be afflicted more. Reason being is, and I'm not going to bore the audience, but there's something called interferon. And there's studies out there that people have interferon to prevent inflammation, but these rogue antibodies that are developed in some people that are having severe cases tend to be 94% men. So males tend to do worse with this illness, but then again, most people do okay. I mean, we're not seeing the deluge of ventilation and respiratory failure like we did at the beginning, because we're getting better treating this thing.
My guest is Dr. Carey Strom. We're going to take a break. Dr. Strom, we come back. I want to ask you, President Trump apparently was tested every day, as were the people around him every day. Does this mean that even though you're tested every day, doesn't mean that necessarily you are negative if the test says you're negative, or positive if the test says you're positive? President's been tested every single day. Let's talk to Dr. Carey Strom about all of that and what does it mean. Larry Elder, Dr. Carey Strom, do not leave town.